This video demonstrates the technique of performing single-pass 4-through pupilloplasty procedure. This is the animation that describes how the suture needle is passed through the proximal and the distal iris tissue. Once the suture needle is withdrawn from the anterior chamber, the suture loop is formed and is withdrawn from the paracentesis incision, and the tip of the suture needle is then passed through the loop 4 times. Having done that, both the suture ends are pulled and the knot slides into the anterior chamber, thereby approximating the iris defect. Here what you see is that the surgeon had performed cataract surgery and a big peripheral iris hole has been developed here, and there is a huge defect which was probably formed due to the imbibement of the iris tissue into the phacoemulsification probe. Hence, in this referred case, I decided to perform a single-pass 4-through pupilloplasty procedure, and it is necessary to close this iris defect as mentioned, because here what you see is that the defect is quite big. It is almost the size of the pupil. Now this is the 9-0 polypropylene suture needle. The surgeon can even choose a 10-0, but that is much more fragile. Hence, in my armamentarium, I consider using a 9-0 polypropylene suture. So as you see here in this case, during this procedure, I have used viscoelastic into the anterior chamber, and I have not used fluid infusion. Now the choice of using a fluid infusion or an OVD depends upon the surgeon, and it also depends upon the clinical scenario. For example, in this case, it's a plain pseudophakic eye, and there is just an iris defect, so it can be performed with an OVD. But many cases, when it is associated with a complicated case wherein we need to probably do some traumatic cataract management with vitreous and all that stuff, so during those times there is a fluid infusion going on inside the eye, and hence the repair is done with the fluid infusion. Now what you see here is that the iris tissue, there's a lot of chaffing. If you see, along the iris defect, the iris tissue has given way, and the surgeon has to be very clear from where you are passing the suture needle, because if you pass the tip of the needle from the shaft area, it will not hold and the iris tissue will give way. So if you see here, I had done a defect repair, but the iris tissue has given way. So now I am again involving the iris tissue much more away from the shaft area so that it does not give way. And it's very important to close down the defect which is very close to the pupil. If you leave a small peripheral defect, it's okay. It's not going to cause much problem to the patient. But the defect should not be close to the pupil, and especially in a pseudophakic eye. So having done that, almost this is a functional repair has been done for this patient, and the defect is completely closed. Always take a suture at the corneal end, and this is the pre-op and the post-op image of the patient.